Well, thank you very much, Susan. I'm happy to be here and happy to see all of you taking time out of your day to participate. So let me get my presentation pulled up here and we will get get started. So, all right. So today we're going to be talking about shockwave therapy in canine and feline patients. This is a topic that's very near and dear to my heart. Um, on our agenda today, we're going to go over just the basics of shockwave therapy. What is it? How does it work in our veterinary patients? Some of the indications that we use it for and the evidence that we have to back up those indications. Along the way, we'll go through a few case examples. And if time permitting, we'll go through some treatment protocols and so forth. And we'll have some time for some questions at the end of the presentation. So make sure you keep those in mind as we go through. So jumping right into it, what is shockwave therapy? Just to dispel any notions that you might have, this is nothing related to electric shock. What shockwave is a high energy sound wave. Shock waves are present naturally, and probably the best example that we have of a shock wave is lightning and thunder. So lightning is an electrical impulse that produces an increase in pressure in the air around it, and that pressure wave travels through the air. So during a thunderstorm, when you hear thunder and the walls of your house rattle, that's those walls absorbing the energy from that shock wave. Other good examples are, sonic booms produced by supersonic aircraft and gunshots. Those are all examples of a shock wave. This is a slow motion video, and this is kind of an exaggerated example, but these three balloons are in a swimming pool, and we're going to set off an electrical impulse over here that's going to set up a pressure wave in that water, and you can see how those balloons react to that pressure. Again, this is an exaggerated example, but it's a good visual to kind of show what happens with shock waves. And then, I think it's important to discuss off the bat here what a shock wave is not. It's not a radial pressure wave that's basically just mechanical energy, similar to theraguns, or there's numerous devices that you can get off of Amazon that purport to produce a therapeutic effect. Those are not shockwave therapy. It's also not laser therapy. While both of those modalities transfer energy to tissue, laser therapy uses light, which has a lower penetration depth, and a lot of that energy is lost to heat. Versus shockwave therapy, where all of that sound energy is deposited in the tissues that we are interested in treating. A good analogy for that is, the tissues in our bodies are made of mostly water, as we know, and light travels poorly through water. Imagine shining a flashlight underwater. That light does not go very far. Whereas whales and submarines, on the other hand, use sound to communicate for hundreds of miles underwater. That is just a demonstration of how sound waves operate much more effectively in tissues than does light. So I mentioned earlier that shockwave is an actual physics term, and what defines a shockwave is an extremely rapid, high energy sound wave that has a rapid rise time. And as you can see on the graph in the upper left there, that rise time is measured in nanoseconds. So that's important to an important defining feature of a shock wave, and also that pressure decrease actually going negative to relative to the starting pressure. That negative pressure causes some slight cavitation in our tissues, and all those things are what actually define a shock wave. And we also have a very well-defined focal area, as demonstrated by the dark blue oval spot on the graph on the lower right there. So that focal zone is where, when we talk about shock wave in tissues, that's where we're having our effect. So we're going to go through 4 different types of generating shock waves, and we'll go into a little bit more detail on the next few slides. But actually there's only about 3 different mechanisms to generate a shock wave. One is the electrohydraulic, the second is the electromagnetic method, and then there's the piezoelectric method. And again, radial pressure waves, which are often marketed as shock waves, are really not true shock waves. They have a much slower rise time and don't produce the energy required to be classified as a shock wave. So the first method is the electrohydraulic method, in which we've got an electrode that's placed in a semi-ellipsoid reflector. And when a high voltage is applied to that electrode, there's a spark that's created. And that spark creates a pressure wave in the fluid that's surrounding it. And as you can see, that those shock waves spread out and are directed toward the tissue. So we get a primary wave that's created just by those shock waves going toward the tissue. But then we've got the waves that are reflected by this reflector in the rear are actually what focuses those shock waves and directs them all toward the focal zone where we are generating our effects. So there's kind of a double wave that's generated by an electrohydraulic generator. An electromagnetic generator is kind of similar to a loudspeaker, in a stereo system, where you've got an electromagnetic coil that vibrates a metal membrane, and that generates those acoustic pulses that form a shock wave on their way to the tissue of interest. The third type of shockwave generator is a piezoelectric, which has an array of piezoelectric crystals that vibrate when a voltage is applied to them. And those crystals are arrayed in a shape that focuses them and generates that shockwave. So, sorry. So when we compare those 3 types of shockwave generators, the biggest difference is in the size of that focal zone. So with the electrohydraulic shockwave generator, which is what PulseVet is, we've got a very large focal zone that's on the order of 140,000 cubic millimeters versus the other 2 types, which you can see both have very much smaller focal areas. So you can think of these as a flashlight compared to a laser pointer. So the flashlight would be illuminating a much larger area than the laser would be. So why does this matter? So the size of the focal zone determines the treatment protocols that we use. So on this chart, we compared the recommended treatment protocols of the piezoelectric generator versus the electrohydraulic generator, such as PulseVet. And you can see that because of that smaller focal zone, the piezoelectric unit requires much more higher pulse doses per treatment and a more and more frequent treatments. Whereas with our electrohydraulic generator, we can deliver those treatments 500 to 1,000 pulses, which can be delivered in less than 5 minutes over a total of 1 to 3 treatments performed at 2-week intervals. So when we talk about owner compliance with our treatments, it's a lot easier to get owners to agree to that level of treatment 1 to 3 times every 2 weeks versus coming in multiple times a week for a month. So now that we know what a shockwave is, which is a high energy sound wave, and we know different ways to generate shock waves, so what happens with a shockwave in our patients, and how is it helping? So shockwave energy is delivered superficially with a handpiece that contacts the skin, and then that energy gets deposited in the area of acoustic impedance or density change within those tissues. So, similar to the walls of your house, when we talked about them absorbing the sound energy from thunder, the macroscopically in the body, that sound energy is absorbed by a bone tendon interface, for instance, or a lesion in a soft tissue structure such as a tendon. And then microscopically, that energy is absorbed by the cell surface. So when those cells absorb that energy, we can kind of say they squish a little bit. That's a good scientific term there, but that's those cells absorbing that sound energy. So we're going to go back to our example of the balloons in the water and think of these balloons as cells absorbing the sound energy from that shock wave. And again, this is a very exaggerated example, but you can kind of picture how the cells would respond to that mechanical energy. So in response to that mechanical stimulation of the cells, there's kind of a cascade of events that happens in response to that. So those cells release a variety of cytokines and growth factors that are important in the healing process. So some of those or those cytokines that are released, they do a number of different things that can generally be broken down into about 4 categories. So the first is they increase blood flow through neovascularization as well as vasodilation and endothelial cell proliferation. The second is that they stimulate cellular bone production through the release of bone morphogenic protein, or BMP. They also modulate pain and inflammation through a variety of different things like nitric oxide, the nitric oxide pathway. And all those things combine to improve the quality of soft tissue healing, such as tendon and ligaments as well. So if you're kind of a more visual learner, these are a couple more images that are showing the same thing. So you can see the variety of cytokines that are released in the figure on the left. So we can, in general, we can talk about shockwave as stimulating the body's own healing process. And another way to think about it is that it reinitiates the healing process and returns a chronic issue back into a more acute situation on the cellular level, which stimulates healing. And then, of course, the blood flow aspect, anytime we increase blood flow to an area, we are going to increase oxygen delivery and increase removal of harmful breakdown products of those tissues. A couple of other things that Shockwave has been proven to do. So it has been shown in vitro to disrupt biofilm. So biofilm is that invisible shield that bacteria produce to protect themselves from things like antibiotics. Shockwave can break down that biofilm and allow antibiotics to work better, which can make it effective in treating wounds or infected orthopedic implants such as bone plates. Um, it also has been shown to decrease cartilage degradation in surgically induced injuries. So we'll talk about this study here in just a little bit, but it was performed in rats and gave some great information about the progression of OA with shockwave therapy. There was also a human study done on OA recently that was published in January 22 that showed shockwave inhibited the increase of enzymes that are associated with joint destruction in OA and so forth. So on the equine side, it's well established that shockwave can induce a temporary analgesic effect that lasts for 2 to 3 days. This can happen in small animals as well and is important to consider in post-treatment recommendations and post-surgical use. So now that we know what shockwave does in the body and how it stimulates healing, let's talk about where we want to use it in our patients. So we'll start with soft tissue indications. Tendons, ligaments, muscle injuries are all great indications to use this for. So in small animal patients, we're typically talking about things like biceps and supraspinatus injuries, the medial shoulder instability complex, Achilles tendon injuries, iliopsoas strains, partial cruciate tears, or complete tears that are not surgical candidates for whatever reason are great use cases. Fibrotic myopathy is another one. So tendon and ligament healing is really what put shockwave technology on the map on the equine side. And as we know, when tendons and ligaments heal when they're left to their own devices, they tend to deposit a lot of scar tissue rather than normal tendinous tissue. And the tendon fibers that are left generally don't have a very good alignment. So it was very common to observe that once a horse with a tendon or ligament injury appeared to be healed, that oftentimes those horses would re-injure very easily afterwards, and that's because that scar tissue is not as elastic and it's not as strong as normal tendon tissue. Whereas when we started treating those injuries with shockwave therapy, we discovered that we could demonstrate a much better fiber alignment sonographically after treatment once those tendons had healed, and that they were much less prone to re-injury after healing. So, and we can expect the same thing in our small animal patients. So we can speed up that healing process. One, by increasing blood flow. So we know that tendons and ligaments generally have a poor blood supply, so it makes sense that improving the blood delivery to those tissues will improve that healing process. So how do we know that shockwave works? Well, we've got over 20 years of published peer-reviewed research on electrohydraulic shockwave therapy, and it's used both in equine animals and small animals, as well as humans. This is one of the early studies that was published on dogs, and it was looking at patellar desmitis after TPLO surgery. So dogs that were undergoing TPLO surgery were radiographed preoperatively and at 4, 6, and 8 weeks afterwards. They were treated with shockwave at 4 and 6 weeks. The patellar ligament thickness was measured sonographically at the distal third of the patellar ligament, and it showed that there was a significant decrease in thickness at both 6 and 8 weeks post-op in the shockwave treated group when compared to the control group. And these images are just showing several different examples of patellar ligament thickness in that study. So this was a study that was performed at Tufts University. It was a retrospective study on dogs with shoulder lameness, and that lameness could be due from biceps and/or supraspinatus tendinopathy or medial shoulder instability. And all of these patients had not responded to conservative management. So they were treated 3 times with shockwave therapy, given 3 to 4 weeks apart. And in the short-term follow-up, 3 to 4 weeks after the third treatment, all 9 dogs had improved or resolved lameness. Long-term follow-up of those dogs showed that 7 of 11 had improved or normal limb function, and none of them received any other treatment other than shockwave during this study. Also, none of them exhibited any complications due to the shockwave therapy. So here's a nice case example. This is a 15-year-old male cattle dog that had a right front shoulder lameness that had been going on for a year. And this dog had been to multiple veterinarians for this condition with no improvement. And finally, shockwave therapy was performed on this dog, and we'll show the progression of that. So this is the dog pre-treatment, and you can see he's really ouchy trying to use that right front leg. So again, this is him walking pre-treatment. So pretty obvious lameness there. Show that one more time. So this was immediately or 2 days after the first treatment. So we can see here that still got a lameness definitely, but there's no doubt that we are improved compared to pre-treatment. And that's that's a pretty typical response to see after in that immediate post-treatment period. So this is had a second treatment performed 2 weeks later, and this is a video taken 3 days after that second treatment. They also treated the carpus on the dog because they felt like there could be some pain coming from that area as well. So again, pretty remarkable improvement compared to what he was before. And this is after the third treatment, and this is a full month after the third treatment. So again, let me show that one more time. So I think we could all agree that those are very good results for a lameness that had been going on for a year with no improvement prior to shockwave. So the next indication that we want to talk about is bone healing. So Shockwave can be used to speed up the healing after fracture repair, and it also can be used in cases of delayed unions or non-unions, similar to these radiographs here. Um, it can also be used in medically managed fractures such as metacarpal or metatarsal fractures. Anything that gets us out of a bandage or a splint faster is a good thing. So, this as a way of demonstrating the increased bone healing. This is a study done at Colorado State, and this was a two-part study. This slide is talking about the first phase of that study. So this was a randomized, blinded, prospective study where half of the patients received 2 shockwave treatments 2 weeks apart, and the other half received no treatments after TPLO surgery. So radiographs were taken in both groups at weeks 0, 4, 6, 8, and 10. And the radiologist evaluated and provided healing scores using both a 5 and a 10-point system. In phase 1, the healing scores at all time points were more advanced with the shockwave treated group than in the control group. At week 4, that difference was statistically significant. It also is worth noting that at 8 weeks, they found that all of the shockwave treated patients had completely healed osteotomy sites, whereas less than half of the sham treated group had completely healed. So this phase of the study involved 13 stifles, 7 in the sham group and 6 in the treatment group. Here's a couple of x-rays from that study. Both of these were taken at 6 weeks post-op on TPLO. The image on the left was not treated with shockwave, and the image on the right was one from the shockwave treated group. You can see that the image on the right is in a more advanced stage of healing compared to the image on the left. And again, this was at 6 weeks post-op. So moving on to phase 2 of that study, 41 more stifles were enrolled in this study. At this point, radiographs were only taken at 8 weeks, as is the standard post-TPLO, and the same healing scores were used again. At 8 weeks, the median healing scores for the shockwave treated group were significantly higher than in the untreated group. So that's just a great study demonstrating the ability of shockwave to speed up the bone healing process. Here's another quick case study done by Dr. Marty Drum at the University of Tennessee. He had 3 dogs that were presented with delayed unions after TPLO surgery. Each dog only received 1 shockwave treatment, and then radiographs were taken at 4 weeks post-treatment. And all 3 dogs were significantly improved, both radiographically and clinically, with decreased pain and lameness and increased weight bearing. So again, these are radiographs from that study demonstrating the 15-week non-union in that the images on the top compared to the 4 weeks post-treatment radiographs on the bottom. This case here comes to us from Dr. Mike Vitucci in Florida. So this was Butters, a 15-year-old male Chihuahua with a 7-week duration of metatarsal fractures that were not healing. So this is the pre-treatment radiograph. So the treatment plan was to splint and perform a shockwave treatment pre-splint and then reevaluate at 4 weeks. So this This is a video of Butters getting his first Shockwave treatment. As you can see, he's unsedated and unconcerned about what's going on there, so tolerating the treatment very well. And also probably worth noting that this is exactly what you would expect a 15-year-old Chihuahua named Butters to look like. um, this radiograph was taken at the 4-week recheck, so we can see significant healing progress with that. The plan at this point was to transition to a soft bandage, and a second Shockwave treatment was performed at this time. And this was the radiographs taken at 2 months, and at this point, no further treatment was performed. So moving on, a third indication that we can use our Shockwave therapy on is osteoarthritis. So Shockwave can be a very important part of a multimodal approach to OA pain management. It can be used on any joint that has arthritis, such as shoulders, hips, elbows, stifles, and intervertebral joints. It helps to control the pain and inflammation, but also helps to manage the disease. As we touched on earlier, studies have shown that Shockwave is able to slow the progression of OA. And as we know, osteoarthritis is this vicious cycle that starts with instability and synovitis. That synovitis causes overproduction of pro-inflammatory cytokines, and those cytokines initiate and drive cartilage destruction within the joint. That results in pain and further inflammation, which again results in more cytokine production and the perpetuation of this vicious cycle. There's always going to be some progression to OA that's expected. So we're never going to cure the disease. We just hope to interrupt this cycle. So Shockwave has been shown to interfere in this cycle right here with the overproduction of the pro-inflammatory cytokines. So Shockwave decreases or downregulates those pro-inflammatory cytokines such as osteocalcin, COMP, MMP, and tumor necrosis factor. Shockwave also increases the good cytokines like VEGF and BMP2 within the joint. So that's how it slows the progression of cartilage damage and relieves the pain and inflammation associated with it. So this is an interesting study, and it was done in rats, but I think it demonstrates what we see also in our larger veterinary patients. It was performed in Taiwan on 72 rats divided into 3 groups. There was a control group. One group had surgically transected ACLs, and one group had surgically transected ACLs and one treatment of Shockwave 1 week post-surgery. These rats were followed out for 12 weeks, measuring blood and urine biomarkers. They were then harvested at 12 weeks and histopath performed on those joints. The results showed that the rats that received the single Shockwave treatment had significantly less osteoarthritis, including decreased cartilage degradation. Shockwave treated knees showed a decrease in COMP, which is cartilage oligometric protein, and osteocalcin, as well as decreased chondrocyte apoptosis when compared to the transected ACL rats that did not receive Shockwave. As I mentioned this study earlier, but this was one performed in humans that was published in January of 22 that compared Shockwave to short-term NSAID use and hyaluronic acid joint injections for knee arthritis in humans. This study also showed that, or study showed that a year after treatment, the shockwave treated patients did not have the typical increase in comp that is expected with the progression of OA. Um, Currently, a canine model OA study similar to this one is ongoing at Colorado State, and we hope to be able to show similar results with it. This is the pain scores associated with that human study that you can see where at all time points the shockwave treated group was lower than the NSAID or the HA joint injection treated groups. This was another study done by Dr. Marty Drum at Tennessee. This was a study on 15 dogs with radiographically confirmed elbow osteoarthritis. And they evaluated the subjective gait evaluations at a walk and a trot, range of motion, and ground reactive forces at a trot were measured on a force plate. Patients received 2 shockwave treatments 2 weeks apart, or were placed in the sham group, and they were evaluated at day 0, 14, and 28. The improvement in ground reaction forces was similar to what we expect when starting NSAIDs in the shockwave treated patients, and the patient showed an increase in ground reaction forces and weight bearing with shockwave therapy. Additionally, the dogs that were initially in the sham treated group were subsequently treated with the same shockwave protocol and showed the same improvement that the initial group did. Similar to osteoarthritis, we can talk about spondylosis in the same way. Shockwave has been successful for treatment of chronic back pain. And when we talk about this, we're talking about non-neurologic back pain because shockwave really has no effect on nerves. Conditions such as degenerative myelopathy are not going to be affected by shockwave therapy, but it does work very well for other types of chronic pain and inflammation associated with the back. This was a pilot study done in California. It was a retrospective study of 38 dogs and 2 cats with lower back pain or cauda equina syndrome. 34 patients received a single shockwave treatment to the lumbosacral area, and 6 patients required a second treatment. Again, it's important to note that there were no adverse effects observed with any of the shockwave treatments, and 88% of the patients had a positive response according to the clinicians, and of those, 77% showed improvement within 1 week, and 80% of them had sustained improvement at the time of final follow-up. The owners exhibited a high satisfaction with shockwave therapy, and 88% of them stated that they would elect to have it performed again if needed. This is a little bit more recent study done at LSU that showed that shockwave therapy was able to improve short-term limb use after TPLO surgery. In a blinded prospective randomized study, patients were divided into 2 groups, one receiving 2 shockwave treatments post-op for TPLO, and the control group receiving no treatment. Using force plate measurements as outcome measures, they found that dogs treated with shockwave therapy returned to weight bearing much sooner than the control group. And that's important because when we think about TPLO, anything that allows us to begin rehab earlier, as well as protect the cruciate ligament in the other limb that we are worried about tearing, that's a good thing. So, obviously, if the patient can bear weight on the leg, the operated leg sooner, it's going to be bearing less weight on the contralateral limb. These are the force plate graphs from that study, showing both peak vertical force and vertical impulse improved in the shockwave treated patients versus the control group. Moving on to fourth indication here. So because of shockwave therapy's ability to increase blood flow and break down biofilm, it works very well for treating wounds. Examples would be degloving injuries or really any wound that's healing by second intention. And it really works great on lit granulomas. This is one of the most common things we hear as feedback from our customers is the amazing things that they see with treating lit granulomas. So we all know how frustrating those can be to deal with. So this is a case of a lit granuloma that had been present for over a year. And it was treated with shockwave twice, 2 weeks apart. And as you can see in the image on the right there, completely healed. This is some other images from a wound treated with shockwave, and the images on the right being of 3 weeks after the third shockwave treatment. So in review, the indications that are treated very effectively with shockwave therapy are soft tissue injuries such as tendon, ligament, muscle injuries, bone, osteoarthritis and chronic pain, especially back pain, and superficial wounds and lit granulomas. So those are kind of the four basic areas that cover a lot of territory when we talk about orthopedic injuries in our small animal patients. So we've got a lot of scientific research that backs up our therapy, and a lot of that research is ongoing. So some current things that are in the works now, there's a study being funded by the Morris Animal Foundation at Ohio State, looking at patients with lower back pain. So again, this one is ongoing, but so far the results are looking very good. Also, we've got, and I mentioned this earlier, but we've got a study at CSU looking at arthritis post-op in TPLO patients. And this will be followed out. Those patients will be followed out for a year. We're currently at about the 6-month mark now, so be looking for the results of that study to be published probably sometime next year. In equine patients, we've got some exciting work being done now with exercise-induced pulmonary hemorrhage and asthma in those patients that has shown pretty remarkable results. And we've also done just a small pilot study seeing if we can improve hoof growth in horses. So those are kind of some of the areas that we're working on now, and there will be new areas that will be investigated in the future. On the human side, currently electrohydraulic shockwave is approved for treatment of things like tennis elbow and plantar fasciitis and diabetic ulcers. There's also some current studies being done on seeing whether we can improve healing of cardiac tissue after a heart attack. And these images on the right are from a study done in rats, showing an improvement in cardiac muscle regeneration after cardiac artery ligation. So I'm going to skip ahead a bit here, just so I want to make sure we have time for some questions afterwards. So, um, in review, Shockwave is a high energy sound wave, not an electric shock. And as we know, sound waves travel much better in the body than do light energy, and that's why we see the increased effects from shockwave compared to those other treatment modalities. Um, it stimulates the body's own healing process. And, another way to think about it is taking an acute condition or a chronic condition, rather, and converting it back to the acute phase on a cellular level and stimulating the healing process that way. Um, when we talk about shockwave therapy, it is important to know how your shockwaves are generated, and all all of the peer reviewed published studies that have been done using electrohydraulic shockwave generators. So in conclusion, pet owners are always up for non-invasive advanced treatment modalities to improve their pet's quality of life. And with the ability to offer that to them, that's a way to set yourself apart, and demonstrate a high quality of treatment performed at your practice. So that was all the slides that I had to present today. So again, I wanted to make sure that we allowed time for some questions.